box and I will get that fixed. Executive Dave Summers was unable to participate today, but we are joined by Snohomish Health District Health Officer Dr. Chris Spitters and Snohomish County Department of Emergency Management Director Jason Biermann. Each of our speakers will give an update, and after they've shared their remarks, we'll be taking questions in the chat feature. Please make sure that you submit your questions to everyone so that all of our speakers can see. And thank you for joining us. And with that, I'll turn it over to Dr. Spitters.
All right, thank you, Heather, and good morning, everyone. Before we turn to COVID, I'd like to provide a quick update on the multi-county E. coli outbreak that was announced last week. We had released at that time, about this time last week, that there were 2 local cases of Shiga toxin producing E. coli involving 1, a woman in her 20s, and 2, a child under 10 years of age. These individuals live in separate households. The child was hospitalized, but no further information will be shared on these 2 individuals out of respect for their privacy. As many of you saw in the Department of Health's release late last week, there are now multiple counties involved. The State Department of Health provided a breakdown of cases by county, but counted only confirmed cases in that release. Those are cases that are confirmed to be linked to the outbreak by matching of the isolate's DNA fingerprints. One of Snohomish County's 2 confirmed E. coli cases mentioned in our press release last week does fall into that category with a confirmed molecular DNA fingerprint link to the outbreak. The other is epidemiologically linked to the outbreak, but because the DNA fingerprinting results for that case are still pending, it does not appear in the state's case counts for the outbreak at this time. Initial findings from the investigation had suggested that these cases may be linked to fresh produce. However, after further work, the State Department of Health has identified a likely link to PCC Community Market brand yogurt produced by Pure Air Dairy. Pure Air Dairy is working with the State Department of Agriculture to identify and recall all affected products. Anyone who has PCC Community Market brand yogurt at home should not eat it and should throw it away. We're continuing to coordinate with the State Department of Health and other partners as this investigation proceeds. Moving over to COVID, we're starting to see some promising turns in our case counts. We saw a decrease in total cases counted over a 2-week period from up around 1,800 cases during the 2 and 3 weeks ago combined. Then if we look at last week and the week before combined, it came down to 1,600. Looking week by week and just rounding numbers, we went from 1,000 to 875 to 750 per week over the last 3 weeks ending last Saturday. And the most recent 2-week case rate, that figure that we track throughout the pandemic now, through May 15th, the case rate had come down to 193 per 100,000. This is the first significant decrease in the case rate since mid-March, 2 months ago, when we achieved a rate of 80 before the 4th wave started up. This is a welcome change, and we attribute this shift in large part to the continued increase in vaccination coverage countywide. More and more people are getting vaccinated every day. Our data through May 11 showed nearly 60,000 doses administered in Snohomish County in just 7 days. We need to keep that pace up if folks want to speed up the June 30 opening date announced by Governor Inslee. Jason will share a little more on that in a few minutes. The governor has also provided some insight into plans to align with CDC's revised mass guidance for vaccinated people that was released on Thursday of last week. We know our residents and businesses are wondering how that needs to be implemented here in Snohomish County. The governor's office and the Washington State Department of Health are working to update guidance documents, and we expect more clarity on that in the coming days. However, Governor Inslee did indicate that this guidance will not, I repeat, not apply to healthcare settings like hospitals, long-term care, or medical or dental offices, or in correctional facilities, homeless shelters, or schools. Staff, customers, students, and visitors in these settings that I have just mentioned should continue to follow existing requirements for mask usage, whether they are vaccinated or not. Masks will also still be required on planes, buses, trains, and other forms of public transportation, regardless of vaccination status. I'd like to acknowledge some concerns we've heard, and that's this question. What if unvaccinated or partially vaccinated residents just opt to skip out on the mask and kind of go undetected? Well, obviously, not only would this slow down recovery efforts, but it's potentially dangerous for friends, family, and bystanders that they encounter. Nevertheless, the potential for such to occur is further motivation for those of you sitting on the fence about vaccination to move ahead and get it done now. The best way to counter the non-compliance of others is to get vaccinated yourself. We also know that some fully vaccinated people may choose to continue masking up for some time, either for health reasons or just out of an abundance of caution. And that's okay. There's certainly no rule against that, and it's not necessarily a bad idea until we have even better vaccination coverage, especially when in crowded indoor spaces. We've been through a lot as a community and as individuals. Just as it took some folks a while to adopt mask usage last year, it may take some time before every fully vaccinated person is comfortable going without masks. We also have about 120,000 children under 12 years of age who are not yet eligible for vaccination. So we need to continue to protect our community until the transmission rates are significantly lower. And that means unvaccinated folks need to continue wearing masks in public spaces, especially when indoors. Until we reach increased levels of vaccination coverage and further reduce cases to a level that permits us to safely relax prevention measures for all, let's spread kindness, not COVID. Mask up until you get vaccinated, and get vaccinated as soon as possible. Now, to share more about the Snohomish County Vaccine Task Force's activities underway, I'll turn it over to Jason Biermann. Jason.
Thanks, Dr. Spitters. Good morning, everyone. I'm going to be providing a few updates from the Snohomish County Vaccine Task Force and the work we're doing. As all of you, I think, know, the governor announced last week that the reopening our economy may come sooner than the end of June. He set a goal of 70% of folks age 16 or older who receive the first dose of vaccine if we want to move that timeline up for reopening. So here in Snohomish County, we're at about 59% of those folks who have initiated their vaccination. So initiated meaning if it's a 2-dose series, they have at least 1 dose. And we're really hoping to see that number to get to 70% or higher soon. We're the 3rd most populous county in the state, and so we know we can play a major role in the reopening of our economy, and we know the way to get there, as Dr. Spitters just mentioned, is through vaccination. Overall, we're making good progress on full vaccination as well, and right now we're at about 44% of our population in Snohomish County that's age 16 or older that are fully vaccinated. Second thing, we're very happy to see young folks getting vaccinated. Last week, providers across the county, including our mass vaccination sites, began administering Pfizer vaccine to people aged 12 to 15. Depending on the location of our mass vac sites, we saw between 45 and 61% of the shots that were being provided by us at our mass vaccination sites, were going to people who were ages 12 to 15. And that was just between Friday and Sunday. So a good amount of young folks who are coming out to get vaccinated. We know that these people are also going to their providers, either pharmacies or their primary care providers. We don't have numbers for those yet, but we also know that they are helping us get that population that has just been authorized to get Pfizer vaccine vaccinated as well. So a lot of work being done with the younger population in Snohomish County. Our mobile teams are continuing to work out in the community. We've had 7 mobile clinics that have either taken place or are scheduled to take place during May, and 5 that have already been scheduled for June. We're also continuing to provide vaccines for homebound individuals. Please have folks refer to 425-339-5278. If they call that number, they can be referred to the mobile team, and we can go out and either help ensure that they have access to vaccine directly if they're homebound. We also have a website where they can, if it's a community-based organization, where they can sign up to host a community-based vaccine clinic. So that's all pretty good news. Statewide, we're also seeing a lot of progress, but there's a small ask I have to add to Dr. Spitter's request as well. Right now, statewide, there's among the folks who are over 65, more than 70% are fully vaccinated, according to the Department of Health. Nearly 2/3 of Washingtonians over 50 have at least gotten their first dose, and more than half are fully vaccinated. The issue really now is folks under 50. We need them to get caught up on getting vaccinated. We know they became eligible later, but vaccine is now readily available. It's easy to get your shot. I've mentioned many times on these calls that we're trying to provide as much access as we can. But meeting the goal to reopen and really keeping the community safe and healthy, as Dr. Spitters mentioned, adults under age 50 can really be the drivers for that, and we need them to be. Vaccination is a key piece for reopening because it allows us to reopen safely. Vaccinated workers are protected, as are vaccinated customers. And we know summer's coming. It's been great weather. We know folks want to get outside. We know people want to see their loved ones. And we know that there are annual events coming up like the Evergreen State Fair. And while they may not be exactly the same as they were pre-COVID, being vaccinated helps us resume those activities that so many of us have missed. So I just want to close by saying thanks to everyone who's been vaccinated, everyone who's out advocating for vaccination, asking specifically for adults under 50 to really take this to heart and increase their numbers that are getting vaccinated. We know there are conversations happening out in the community. We know when people hear it from a friend, a family member, or a loved one, that it means more. So I hope everyone out there will continue to talk to their family and friends about getting vaccinated, encourage them to get their shots. We're trying to make it as safe, quick, and easy as possible. And we do have a lot of appointments available through the end of the month at our MassVac sites. So with that, I will close and turn it back over to Heather for any questions.
Thanks. Our first question is from Joey Thompson. Do either of you think the governor's goal of 70% might persuade folks on the fence about vaccines to get a shot?
Honestly, I don't know. I can't say.
We certainly hope so. And we certainly hope that folks who are bringing their 12 to 15-year-olds, now that they're eligible, if they were not vaccinated previously, that they'll make their appointment as well. And we'll get more folks who get vaccinated.
From Ryan, for Dr. Spitters, do we believe we are now officially on a downslope for new cases after weeks of saying we think we are?
Well, I think the data speaks for itself. So we peaked up in the 220 range for a couple of weeks, came over the top, and now are down to 190. And so yes, it's come down, and the goal is to keep it going down with increasing vaccination coverage, continued wise use of prevention practices by everyone, and then we should be able to drive it down further. And the goal is zero. We may not get to zero, but I think that's the direction we want to take things and have it sustained and then be lasting after that. With a healthy background of broad immunization coverage in the whole county.
The next question, the state has been working with businesses to find ways to provide gift cards or other incentives for vaccines. Is anything like that in the works with the county?
Well, I'll speak to the part I know about. Jason, you may know more as well. We had explored that, but our understanding is that from the rules around the funding that supports mass vaccination is that it's not a permitted use of the funding.
Yes, and that's correct. And I'll just add that we're continuing to look into other avenues. We certainly do want to help incentivize folks as best we can within the policies and the rules that we have to abide by. But yeah, we are still looking at that, but that's what Dr. Spitters mentioned is accurate.
The governor is no longer using cases or hospitalizations, but if your numbers start trending back up, will you consider imposing restrictions on your own?
Right. Well, certainly we're going to continue to monitor both transmission, counted as cases and outbreaks, and the societal health impacts that result from those cases, like hospitalizations, deaths, cases in long-term care facilities. We'll continue monitoring that, and if we are experiencing a surge in transmission or the ill effects of it that are impacting the county adversely, I think a couple things. One, of course, we'll want to talk to the state and our neighbors about what are we going to do about this. We're certainly not an island. If it's happening here, it's likely going to be happening next door, north, south, east and west to some degree, but certainly we in King County and Pierce County, although slightly different in the exact number, our trends have mirrored virtually the whole way. So, we're all in this together, and if things take a turn for the worse, we'll be talking about what the best thing to do is to protect society.
Following the CDC Mass Guidance, what advice have you been able to give or will you give to businesses when it comes to masking before the state gives official guidance?
Well, is to follow the existing state guidance until new state guidance is issued.
Is the task force seeing any trends geographically for vaccination rates, or is it predominantly with age groups?
Yeah, I wouldn't say trends geographically. It's still been, as I mentioned, I think last week, there's no particular trend in geography, but we certainly, like I mentioned, we're glad to see a large number of 12 to 15-year-olds who came to the sites. And so we're hoping to continue to see that trend stay where it is, because that means more people are getting vaccinated.
We also face a technical challenge in assessing and monitoring that, and that's that roughly 350,000 of our 830,000 residents live in unincorporated areas of the county. I think I have that number right. It's ballpark in there. So that's about 40% of the county does not live in an incorporated city. So when the census counts people, it doesn't assign those individuals to a city. When you go and get services and you give your mailing address, say Mount Lake Terrace, so the service, when you get counted in the numerator, you do get assigned to a city because that's what you use and that's what ends up in the database. But we don't have accurate denominators for that because, as I said, the census data that generates the number for the denominator to do the rate, it undercounts the number of people sort of assigned to a city, even though they're not living in the city. They get services and put their postal address that has a city. So that just, in a county like ours where there's so many people living in unincorporated areas, it makes that data very problematic to generate and unreliable.
Are there any plans to start offering vaccines at public places, such as an Aqua Sox game like we've seen in other places?
Well, like I mentioned, we're certainly amenable, and we have been looking into things like that. And certainly we're talking with some of those organizations also about messaging, and because they're venues where a lot of folks show up. So we're talking to them also about messaging or being able to partner with them around messaging to get people vaccinated. So yes, but I just want to emphasize again, and I think I've said this on earlier calls as well, the mass vaccination site, simply because of the throughput and the ability to get a lot of people vaccinated quickly, really are the way that, they're really our priority on the county, and certainly our other partners around the county, our primary care providers and pharmacies and others are out there doing the work as well. But for us, the priority is is as many folks as we can get through quickly and safely is what we're trying to achieve.
What's your feeling about the CDC mass guidance or changing mass guidance? Many are saying it's too early. Do you agree?
Well, that's a tough one. I think, first of all, the notion that vaccinated individuals are at markedly lower risk of, 90% plus lower risk of acquiring the infection if exposed, well, that speaks for itself. So that's, that data is the main factor underlying the CDC's change in the mask guidance to limit it to people who are unvaccinated. It would be naive to think that that's going to be simple to implement, especially for businesses and, venues. How are you going to be able to efficiently and accurately differentiate between the vaccinated and unvaccinated individuals? Will the if that's a trust issue, then we have to be realistic that it's uncertain the degree to which the unvaccinated individuals will be motivated to continue to mask in settings where it's trust-based. So there's some challenges with its implementation, and we'll see how the state's guidance looks to help toward that implementation. Having said that, I think some public health officials do have concerns, especially about crowded indoor spaces, combined with the difficulty of differentiating at the front door between who's vaccinated and who's unvaccinated. So it is a challenge that we will face in implementation.
As you look at the vaccination trend and the statewide trend, is there a good chance that the state can reopen fully sooner than June 30th?
I think, like most predictions, very hard to make. And, I think we're on track to exceed 70, and certainly our goal, our aspirational goal is 100%. I think a realistic goal is to try to get 90% of the county and the state vaccinated. The timeline on which that occurs, we were really moving fast there. Things have slowed down a little bit for a couple of weeks. They picked up again. There's so many moving parts. It's really hard to make a prediction, but I think we're on track to be there at least by that date, if not before it.
How has the expanding hours and days of operation at the mass vaccine sites gone? Are enough people taking advantage of that?
Yeah, it's gone well. There seems to be, and again, I think some of this we'll see once we get a little further past the opening of eligibility for 12 to 15-year-olds, but certainly the weekend and after hours availability seems to have been popular. And I think it is something, we did in response to folks saying they were having a hard time getting to the clinics during regular sort of traditional day working hours. So far, so good. But we continue to assess that. And like I said, we'll certainly be looking and seeing as we get further away from the new eligibility, if that continues.
Should those 65 and up with underlying health conditions continue to be cautious, keep distance, and mask up even after being fully vaccinated?
Well, certainly there's some, I think you ask it because it's got some instinctive appeal, although there's no explicit guidance in CDC's updated mask recommendations addressing what you say. I think it's, every individual can and should, make a choice for themselves if they're fully vaccinated. How comfortable are they tolerating the residual risk of having a breakthrough infection, which so far are, exceedingly rare. but can occur and are more likely to occur in groups that have a less robust response to the vaccination. So immunosuppressed individuals in particular, more than the elderly, are severely immunosuppressed individuals, folks with, on immune suppressants for organ transplants and stuff like that. I personally, if I were in that situation, I'd continue to mask up, avoid crowded indoor spaces and such until the coast was quite a bit clearer. The average healthy 72-year-old who's fully vaccinated has a choice to make. Their chance of getting COVID has been reduced by about 90%. Their chance of being hospitalized by more than that. And are they willing to tolerate that residual risk, or do they want to continue wearing a mask to try to, further reduce that risk? At this point, the guidance from CDC implies that's an individual choice, and it's one that I would support and recommend, especially for people who are severely immunosuppressed, have multiple comorbid conditions. There's no harm in playing it on the safe side and avoiding crowded indoor spaces, or if you are going to a crowded indoor space, putting a mask on, even if it only makes you feel more comfortable. There's certainly no harm in that.
During the slowdown in demand, how much vaccine waste occurred at mass vac sites?
To my knowledge, none. We had the one very, very close near miss when we were scrambling with some doses that were set to expire, but to my knowledge, we haven't so far wasted any through a lot of hard work from a lot of folks who keep accountability of it, and and just the outreach efforts that were done by with the help of a lot of folks on this call. The one time when we got pretty close.
Last week, Karina mentioned that asking for insurance can scare off some people from getting vaccinated. How can the mass vaccine sites address this, and are there any plans to tweak registration?
Yeah, I'll speak briefly, and then Jason, you may have more insight. I think in principle, we've been trying to message consistently that lack of health insurance, lack of ability to pay cannot, and should not be a barrier to getting vaccinated. There is that question on the registration sheet, and none is one of the options, and you can keep going and register. But I can see where in concept that just having to answer that question might make somebody turn back. Prep Mod, which is the interface that we use for scheduling the mass sites, still has that question. We're not in direct control of its content. Do you know any more about that, Jason, whether we're trying to downplay that?
No, and you covered it well. We're really trying to message to folks that insurance shouldn't be an inhibitor, or lack of insurance shouldn't be an inhibitor to getting vaccinated. We do have community advocates who are also out working now in partnership with a couple of community organizations to try and be out directly helping people if they have questions about that as well. So no, that the way we address it, as Dr. Spitters mentioned, is we're trying to consistently message that anyone can get vaccinated. But right now, to my knowledge, there's no plan to tweak the registration process.
All right. It looks like all the questions that we have in the chat box. So we are going to go ahead and wrap up for today. Thank you for joining us, and please stay tuned for future media availabilities.